What does an adenocarcinoma pathology report mean? Imagine opening a report that holds the key to understanding a lung tumor diagnosis. That's what an adenocarcinoma pathology report provides. It's a detailed document that describes what the cancer looks like under a microscope and helps doctors decide the best way to treat it. Adenocarcinoma is the most common type of non-small cell lung cancer, which makes up the majority of lung cancer cases. This report is essential because it gives a clear picture of the tumor's characteristics and how it might behave. First, the report confirms the diagnosis of adenocarcinoma, which originates from glandular cells in the lung. These cells normally produce mucus or other substances. The report may specify if the tumor is invasive, meaning it has spread beyond its original spot, or if it's in a pre-invasive stage called adenocarcinoma in situ. Adenocarcinoma in situ has a very good prognosis if completely removed because it hasn't spread yet. The report might also mention minimally invasive adenocarcinoma, which shows limited spread but still has a good outlook. Next, the report describes the microscopic patterns of the tumor. These patterns include lipidic, acinar, papillary, micropapillary, or solid. Each pattern can give clues about how aggressive the cancer might be. For example, lipidic growth tends to be less aggressive, while micropapillary or solid patterns are associated with a higher risk of spreading or recurrence. The report also notes how well the tumor cells resemble normal cells, called differentiation. Well-differentiated tumors look more like normal tissue and tend to grow slower, while poorly differentiated tumors are more aggressive and tend to have a worse outlook. Modern pathology reports often include genetic testing results. These tests look for specific gene mutations like EGFR, KRAS, or ALK rearrangements. Knowing these mutations helps doctors choose targeted therapies, which are drugs designed to attack specific cancer cells. This is especially important when the tumor is advanced or has spread. The report also assesses whether the tumor has invaded nearby structures such as blood vessels or lymph nodes. If cancer cells are found in lymph or blood vessels, it indicates a higher chance of the cancer spreading and can influence staging and treatment decisions. The report also checks if the tumor was completely removed during surgery by examining the margins. Clear margins mean no cancer cells are at the edges of the removed tissue, which suggests the tumor has been fully excised. If cancer cells are present at the margins, additional treatment might be needed. Other details, such as tumor size, presence of dead tissue called necrosis, and how the tumor responded to any pre-surgical therapy, are also included. These details help doctors understand the tumor's behavior and plan the next steps. In summary, a pathology report for adenocarcinoma is a comprehensive document that describes the type, microscopic appearance, genetic features, and extent of the tumor. This information helps determine the stage of the cancer, predict how it might behave, and select the most effective treatment options. Whether it's surgery, chemotherapy, targeted therapy, or immunotherapy, understanding the report is crucial for personalized care. If you or someone you know receives such a report, it's important to discuss it thoroughly with healthcare professionals who can interpret the details and guide the next steps. Remember, each case is unique, and treatment plans are tailored to individual needs based on this detailed information.